Hello, my name is Julie McCrossin, and in 2013, I was diagnosed with stage 4 HPV-related oropharyngeal cancer. It was in my tonsils, the back of my tongue, and the side of my throat. I was 58 when I was diagnosed, and I'm 68 now. It was a massive shock. I had not drunk any alcohol or smoked any tobacco for over 35 years, and I had absolutely no idea that HPV could cause throat cancer. The treatment for head and neck cancers is tough. My treatment was 33 sessions of radiation therapy over 33 consecutive days with weekly chemotherapy. Radiation therapy saved my life, but the side effects are severe and some are lifelong. I lost over 20 kilograms in weight in 6 weeks. I lost speech completely for months, and I lost the capacity to swallow almost completely, but luckily I was able to continue to swallow liquid food. How can you help prevent cancers caused by HPV, and how can we improve access to treatment? My key message is this: we need to overcome the taboo about talking about sexually transmitted HPV viruses and cancer. We need to talk openly and in a relaxed manner about oral sex and anal sex. HPV causes cervical, oral, penile, vaginal, vulval, and anal cancers. We need to break the taboo about talking about these parts of our body so that people will go to their doctor if they're worried that something is wrong without being too ashamed or embarrassed. We need to break the taboo so that parents will make sure their children get the HPV vaccine when their children are 12 or 13 before they are sexually active. The HPV vaccine developed in Australia is marvellous, but people will be getting HPV-related cancers for many decades to come because most people over 30 have not had the HPV vaccine, and many countries have limited uptake of the vaccine. Let me show you 3 Australian examples of public health education to break down the taboo about talking about sexually transmitted HPV and cancer. Head and Neck Cancer Australia provides comprehensive information about HPV and cancers of the head and neck on their website. This new booklet, Throat Cancer and HPV, is designed to answer key questions for patients and their partners on diagnosis. It answers questions about sexual intimacy after diagnosis. This booklet is currently available in PDF form on the Head and Neck Cancer Australia website. Cancer Council Australia publishes Understanding Head and Neck Cancer, and Cancer Council also has HPV-related information online and in print. And in a world first, Cancer Council New South Wales has just published LGBTQI+ People and Cancer, a guide for people with cancer, their families and friends. Some practices increase our risk of an HPV-related cancer, such as oral sex and anal sex. The number of sexual partners we have increases our risk as well. These are facts the public needs to know. Homosexuality is still a criminal offence in over 65 countries around the world. And this increases the taboo about talking openly about HPV and other sexually transmitted viruses. We need to help decriminalise homosexuality in every country. This is a public health issue. Please help us to break the taboo in talking about HPV and human sexual behaviour. This will reduce HPV-related cancers. Thank you.